This record of the Rett disorder contains contributions from many of the people who suffer from it, their families and research colleagues. All the video material was captured and is included with permission of the families. It reflects experience with the British Isles survey for Rett syndrome between 1982 and 2005. And it aims to show how the disorder presents at different periods of life and with different levels of severity. Also, it shows the positive attributes of people who suffer from it. It is not intended as an exhaustive account of the disorder, nor as a prescription for treatment, but as an aid to recognition and understanding of the disorder.
The disorder is named after Professor Andreas Rett of Vienna, whose account was published in 1966. The disorder occurs in at least 1 in 10,000 girls, many women, and very few boys. It affects all racial groups and is usually associated with profound intellectual and physical disability. This presentation is known as the classic or typical Rett syndrome because all the diagnostic signs are clearly displayed. These include the lively interest in face-to-face contact and attractive appearance, with some reduction in brain growth, the widespread involuntary movements, most noticeable in the hands, the irregular breathing, and the disturbed muscle tone, tension, which may be diminished or increased, leading to postural difficulty and a risk of contractures. Here are the typical clinical signs which are obvious in classic cases and less obvious in the very mild or the very severe. Head growth is usually in the normal range at birth and usually falls to around the 3rd centile. Infant development is mildly retarded, although there is some progress. A period of regression commonly occurs around 12 months, when speech is often lost and hand use decreases. Muscle tone is frequently disturbed, reduced early and increased later. Sleep disturbance is common. Breathing becomes irregular. Involuntary movements become prominent, including hand clapping, rubbing or squeezing, with dyspraxic hand use. Epileptic seizures are common after the onset of the regression period. This shows the growth in head circumference, occipitofrontal circumference, with age in Rett, the yellow dots, compared to the normal range in growth shown as 3 lines.